Okay, so Dr. Amin, one thing that really surprised me when I was speaking to you is learning how dentists, what they experience when they take CE courses, right? So you were telling me the story of how when you learned to do implants years ago, how you go into a classroom, they teach you a lot of theory, you practice on like models like typodonts, and they say, okay, well, you're good to go. You've learned. You're ready for implants. And maybe if you can convince somebody like your cousin, your friend, your mother to come in and do implants with you, you could do that during the course. But a lot of the time, it's like you don't actually get any patients unless you know how to find your own patients. You're not going to be provided with any patients. You simply learn a bunch of theory. You learn how to do it on like a simulation, and then you're good to go, except you're not really good to go. And a lot of dentists end up flying to Mexico or Dominican to actually get some real experience. And to me, when I was listening to that, it seemed really bizarre, it was so unorganized. And I just want you to kind of tell us, like, what was it like when you first started to learn implants, when you were going through the courses, when you wanted to offer this in your practice? What did you experience?
Okay, thank you, Nick, for for having me today. And yes, you forgot one thing about what we talk is the certificate. Once you get the certificate, you say,
Right.
okay, I am there. I am the hero. I can make it. So, I mean, back in the days like 2007 and 8, implant courses, they were really expensive. Only, we'll say, like only star implantologists will do these courses. So I decided to take my first course with, I remember with BioHorizon. It's one of the implant companies, a very successful implantologist. He passed away. His name is Carl Mish. He's a like really big star. He has many books and everything. So I decided to learn from those people, right? And when you read his book, his series of books actually in surgeries and prosthetics, it is very comprehensive and gives you lots of theory and understanding of the like the basics that you need before you go and drill, like as you said in the patient's mouth. That's what we call it. You drill a hole in a patient's mouth, right? So it was very successful experience to me. I learned a lot actually, though it was on either peg jaws or plastic typodonts that you drill a hole on the table.
So
And
like cadavers, you mean like yeah.
cadavers, yes,
Yeah.
kind of cadavers at that time. And then you learn and you see all these beautiful cases done by those implantologists. Like they are really nice, beautiful. They have tons of experience, so it's just very simple to them. So they try to simplify the procedure to you. And once you're done with a 7-10 day course, then you'll say, okay, so I have done the drilling sequence. I have seen those SAR dentists, they were doing it, so I can do it for sure. And the moment you go there, it is a different world, really. So you go, you pick your friend, you pick your whoever relative wants to be the
Let you experiment on them, basically. Right.
anything, and you start your sequence, and boom, first thing you know is okay. So where I am going to sit, and you start thinking, okay, I have to place it in this place at that position. But wait, where I'm gonna sit? Like, where should I? Like, should I be on the back? We call it 12th position or 9th position or like or 11, position. So
So
it's
that's because you
so
learned on a table, right? You have a
yeah, of
typodont. You're
course,
not
yeah.
actually, it doesn't simulate what it's
No,
like
it's
with a real patient in the chair.
never simulating. And then you go and you place your implant, and but it takes you like real effort, and the sweat, you can feel it under the mask and the yeah and the head cover. So you basically struggle and then you say, does it work really? Like, should I continue doing that? Because it's so much like effort. And then it comes to, okay, no, I spend that money, I spend that time. Let me continue, and I want to do that. I want to be successful in implants. And then it comes to who's going to bring you those patients? And then you get like, there is no staff trained, right? Who's going to bring you those cases? It's your staff,
Right.
your hygienist, your front desk, your manager, how you advertise for yourself. So basically, you're stuck in a world where if you see some cases in the hygiene room where you have to have enough thickness of bone, and most of the cases, guess what? After after removing or extracting a tooth, 3 to 4 months later, the patient loses 30% of the bone width, and you're stuck. Okay, so now what I'm gonna do? Like, I need to place implants. So you have to start looking for those patients where they have like really the ideal things that you have learned into your course.
Like good case selection, right?
Good, yeah, exactly. Because you can't risk your cases. And then it comes to, oh, but that patient, he's a smoker. They told us in the course, do not place implants in the smoke back in the day. Because it reduces the success rate, which is like really, if you look into implant success rate, it's really interesting, 95, 97%. Now, the definition of success rate need to be clarified in these courses, because yes, you get your implant, you found that ideal patient, you place your implant, but after all these struggles, they never taught you how to deal with that patient. What does compliance mean? What does success rate mean? In my dictionary, success rate means, and many implantologists as well, success rate means that implant stays in the patient's mouth more than 10 years. So success rate is not that this implant, okay, integrated, great, you place your implant, and that patient still not coming to the hygiene visit, still smoking. You still, see him like when he comes back after a year or two to fill another tooth, you see the plaque and calculus. So case selection.
Right.
Nobody told us. Nobody taught us how to look for the compliant patient beside the bone, beside the gum structure and everything. But patient compliance, patient attitude, patient selection, all these matters really to be like successful in implant dentistry.
Yeah, I
And
mean, it sounds to me like it's like you learn the theory, you don't necessarily get the practical experience, because if you're just practicing on a plastic model or a cadaver, that's not the same as a real patient that might be nervous, or they're sitting in your chair, you're not really sure, like, where do I sit, how do I talk to them, how do I calm them down? It's probably hard to calm them down when you're nervous, because it's like your actual first real case. But on top of that, to be successful with it's almost like, well, how are you going to get those patients? Like, who's calling you? Just because you got a certificate on your wall saying you do implants doesn't mean the phone's going to ring because people want to do implants with you. How do your staff talk to patients about it, right? Because no one's going to walk in with a credit card and say, I'm ready for implants. They need to talk to the staff. They need to, have that treatment presentation. So that's not really covered. So it almost feels like they give you the 20% of the training where it's like, okay, you understand the theory and you understand the mechanical skills you need to kind of use, but all the other pieces that would dictate whether you really are successful in your practice doing implants, it's almost like, well, you need to figure that out on your own.
It is a struggle, and you mentioned very valid point, because patients and anxiety will definitely become your own anxiety. Like, their stress is your stress. So if you cannot manage these things in the beginning, you're out of the game, believe me. Like, you cannot continue, because I mean, you might be able to place here and there, but the number of implants, the number of successful cases of implants, it will be really not interested. The scientific information, lectures, and everything should be there. I think simulation of the clinic atmosphere and environment has to be there. I don't want anybody to think that if you go to course and you place implant on, or you do tissue grafting, and you know what, like, this is really another thing, like soft tissue grafting. You can't do that on a table and you expect that you handle all these soft tissue from the palate. You get your graft and place it on another area. It is something easy. You can't do that. You cannot expect that the peg has the same tissue material like human. It's totally different, these cadavers. So in my opinion, when I would like to think about taking a course now, it has to be different. It has to be really structured in a way that I would like to do my work myself, and I would like to have supervision beside me. I would like someone to start the procedure first in front of me, and then I will practice another on a patient, but under supervision. So it's not enough that I place it on a table and then the following day I see a video and then, okay, I'm good to go. It's impossible. These videos are so helpful to remember the sequence of the procedure, but believe me, Nick, it is very different when you go in the operative room with that patient, giving the freezing and thinking about, okay, I'm placing this implant. What should I do now? It's very hard for people who start the next step. So I think, again, about how we can succeed in future courses is to really simulate these operative rooms. It can be typodonts, it can be anything, but it has to be on dental chairs where I sit on that, my assistant on my side, and like I get the whole experience of placing implants. So when I go back now and place it in my patient, at least the sitting position, and it's not an issue.
It feels natural at that point, right?
Exactly. You don't have to think where should you sit, where should you look to this implant, how should I look to the drip, because it's more easy for you now, and it's going to be like really best for your for your self satisfaction and how you feel inside the surgical room.
Yeah. One thing you had mentioned to me, which I found really shocking, was like in a course you were placing an implant on a typodont, and it's like, hey, it looked great. And then afterwards, you kind of had this realization of like, if this was a human head with jaws, like with cheeks, how exactly would you drill from this angle? Like you're coming in from the tonsils, like that doesn't make any sense, right? But no one kind of clued into that. It's like, you've got this like set of teeth on a table and you're like drilling in. It's like, okay, I know how to do it. It's like, explain to me how in real life you would ever do that. It's you're not working on teeth. You're working there's a head there. And yeah, it was just really kind of bizarre that these courses, which like you said, they're not cheap, right? Like you're not talking $500 for this course. A lot of these courses are tens of thousands of dollars, and it's like, this is the best they have to offer. So yeah, what I thought was interesting is you're looking to create a course. Like at this point, how many implants have you done? Like, what would you ballpark?
Well, I mean, it's hard to count for 20 years, but if I go by year, I place almost like between 150 to 200 implants a year.
Okay,
so I would say around maybe 2,000 implants or more. I can't really count them, but I do statistics for implant cases every 5 years, and my statistics goes for like 4 dental offices, and it's about like 500. I take 500 patients, like a selection specimen, so that I know what I'm doing with this, for example, kind of implant, Straumann or Astra or whatever kind of implant you're placing, because I have to evaluate the implants that we're using as well, the surgical
success rate of the different types of material. Okay.
Of course. After all these years, of placing implants, passing through these difficulties where like going through courses where you need to learn how to select the patients, for example, going to another course where how do I do marketing for implant cases, courses how to do treatment coordination for my staff inside a room for financial arrangement, what offers I should do there. Now you go also to 2 or 3 more courses on placing implant, tissue grafting. I went through all this, and I was thinking with my colleagues, Dr. Quincy, she's a periodontist, and Dr. Ali and Dr. Ali, we kind of we're thinking of like, I want to do something that gives very like practical experience. Yes, we need the knowledge, definitely 100%, but we want to simulate exactly what's happening on a daily basis. How I want to bring those patients to my office, how I would deal with them, how my staff speak on the phone with them, and then how I present the treatment plan, and how I gauge my patients, because really it is important. Like, those patients will tell you, okay, is it forever like thing? Can you guarantee this implant forever? Okay, can you guarantee your life forever? You cannot guarantee anything, right?
But you don't know how to approach the conversation with the patient, because the questions do come up, and then the dentists don't know what to say. Yeah, exactly. I mean, I attended one of your courses with the Invisalign, right? And I thought what was interesting is you spent a lot of time talking about all the things that can go wrong, right? Because I think a lot of courses say, look how great these cases are. It's very easy. You drill here, you do this, and everything is great. And I think in some respects, it sets the wrong sort of impression, because yes, if you're experienced, if you've been doing this for 20 years, then, most cases go very simple for you. But when you're new, your chance that there might be a mistake is higher. You don't know which cases to select and which ones to stay away from. So I thought it was interesting that you spent a lot of time talking about, here's all the types of patients you want to say no to, because you don't have the skill level at this point to actually deal with this case correctly. You're setting yourself up for disaster. Or here's all the things where, the simulation showed it's going to end up like this. And then you look at the patient 3 months later, and it's like, that doesn't look anything like what the simulation software said. How do you deal with that? How do you talk to patients about that? And it kind of shocked me that this isn't really part of most courses. It's in and out. Here's how great it is when everything works out just right. And luckily, hopefully, fingers crossed that's what happens. But if it doesn't, you're on your own. Like, you figure you're not going to call the course professor and say, hey, you told me this would be simple. This is what I'm dealing with. What do I do now? They're not there to help you, right? There is no mentorship. There is no sort of like, let us do it together. Let us do it with me doing it and you watching. Let me, you're doing it and I'm watching and correcting you. And then even once you feel you're ready, it's like, I'll still be there to kind of monitor and be there to help you if something goes wrong, hypothetically. Okay. So is that kind of what motivated? I know you run 4 practices. You've got a lot of associates that you train. Is that what sort of motivated you to start High Tech Dental Seminars, to give people much more practical experience?
Exactly, Nick. Thank you for mentioning that, because I think one of the main issues that stops many dentists of maybe doing clear aligners or doing Invisaligns in their offices is the fear of being failed. Right? It's simple, because it is there. Failure is there if you don't do steps right. If you are not in a course where you simulate the real experience right, you will fail definitely. If you don't know how to select the patient, you will fail definitely. And I have like many dentists coming to me and saying, okay, so if I place implant, but I want to practice and place an immediate implant. I want to extract the tooth and place my implant. I said, okay, but there are more behind it. You need to get the real experience of placing implant, to know how to feel the tissue, the bone. And it takes you between, we say the number 50 is the ideal number. Same goes with the clear aligners. Many, like when I went to for example, clear aligner course for the first time in 2014, it was Invisalign, provided by Invisalign. And it was a course for 1 hour or an hour, 30 minutes. And
wow. Okay.
You go and you practice Invisalign, you take impressions, and then you let those technicians to send you these softwares where it shows you, oh wow, this is the patient before and after. That's it. I'm the greatest. That's it. So when you go in that field and you see the result is not there. Like, what's going on?
It doesn't always turn out how the simulation
No,
shows, right?
no, exactly.
Yeah.
And you know, like
And can you
we
call the
talk,
technicians and like get them to speak to
that's
the
the
patient afterwards?
part.
It's like, why don't you guys deal with this now?
No,
Because you promised me
exactly.
this.
You
Yeah.
promised me this is the picture. Like, they send you the video and it looks, oh wow, it's fantastic. So the problem is like that. You know, I told you, like, my passion was always cosmetic dentistry, right? So when I was placing implants, I found that there were lots of congenital missing laterals, these class twos and malocclusion, where when you look at them, okay, I'll place implants. The whole thing is not looking right. I need to do some changes before I proceed to place my implant. So that's why I did this mini residency in orthodontic for 2 years. And then there it clicks, okay, now things make sense. I have to control that technician. I will never rely on any like great videos they sending to me, because I need to place my treatment plan. I need to control the game. And they are
Yeah.
there to follow my instructions. I'm not there to follow their instructions. And typically, you will never learn how to do clear aligners in 2, 3, 7 hours. It's impossible. It's just impossible to do
You need
that.
more practical experience. Yeah, I agree.
Of
Because there
course.
was
Yes.
a marketplace investigation done by CBC with Invisalign. In most cases, I mean, they turn out great, right? Like my wife had Invisalign done. She loved it. It was fantastic. Everything worked out great. But like you mentioned, it's like 95% of cases turn out great. But there's those 5% that can make or break your business, because, you know, they could turn into absolute disasters. And in that course, you had showed an example where it's like the simulation software is saying that this is the plan, like how this is how we're going to shift the patient's teeth. But you had showed an X-ray showing their throat, and how it's like if you're pushing the teeth back,
Exactly. It will affect their breathing. Yeah.
it'll
Exactly.
affect their breathing. But these are
Yeah.
things that, you know, it doesn't take into account when you're just doing an impression of the mouth and just sending in a scan to Invisalign, you know, for their system. The responsibility as a dentist is on you to look at the entire big picture and understand, like, does this actually make sense for them? And this is what the CBC was highlighting as well when they were interviewing the one of the orthodontic trainers at the university. They said, you can't just treat a patient by just sending in some impressions, and you need to look at this person. You need to understand their health history. The investigation was a criticism against Smile Direct Club, where yes, most people who send in their impressions, they're going to get their trays, everything's going to be okay. But there was one patient in particular that they were investigating, where after wearing the trays for a couple months, his teeth started to crack and some of them fell out.
True.
Right. So, this can happen as well, potentially with Invisalign. If you're not, like, as a dentist, you're just approving the plan without really understanding what you're approving.
What's
right.
the
It's
concept?
like, yeah, it's like, oh, looks right. I mean, I don't know. I'm sure it'll be okay. It's like, but no, as the dentist, it's your responsibility to take care of that patient, right? So if something goes wrong, it does kind of fall on you. And I don't believe Invisalign's going to swoop in and deal with the problem. It's like, you approved it. You, as the dentist, signed off that this was okay. We gave you a suggestion. So yeah, I thought it was interesting. I did interview another dentist that we work with, and he mentioned he did take an Invisalign course, and it was exactly what you mentioned. It was very quick. It wasn't done by Invisalign, it was done by another company, but it was a lot of online videos. And he said by the end of it, it's like, I really don't feel that confident to offer this, because if something goes wrong, I really don't have any idea what to do. Or if the plan they're giving me actually does make sense, or if I'm trusting it in sort of blind faith.
Yeah, that's true. I'm happy that you learned about the airway and breathing, Nick, in that course. This is interesting to me.
It was surprising that I assumed, most dentists would understand how to do like a ceph analysis, how to look at different like a lot of what you were teaching. I assume, like, doesn't everybody know this already? And when you said, like, no, this is not taught.
Believe me, we're never taught about how to read these records and how to take these records in detail. So yeah, that's interesting. And same goes to implants. And the funny thing, like when you read the statistics, like 70% of population, they need alignment of teeth, right? So 70%. And in America and North America, 70% of your patients, that's what I tell my like the dentist in courses, like 70% of of your patients need orthodontic treatment. And in this course, like the step-by-step, for example, clear aligners, we teach them to treat at least minimum 50% of those 70% cases, because these cases can be treated really by dentists if they know how to take records, if they make sure that everything is up to the standard, how to read the cephalometric, how to do the analysis, how to study the angles in the mouth, and then formulate their treatment plan, and then send it to Invisalign or Sure Smile, and the rest is just of course it's technical, like technician work, but the main thing is I know what I'm expecting to get from that case, and this exactly goes to same way to implant. So implant, as I told you from the courses I got, all beautiful. Where is the complication? Where are the failures? Where
you're going to learn from. Yeah. It's the ones that go
I
wrong.
want to learn. I want to learn the tricks when, for example, I go to my office and I'm a dentist. I was trained to do a crown on an implant, and I finished my case. And then after 2 years, this patient comes to you and the crown is loose, and you don't know how to evaluate whether is it implant failure or was it the screw is loose. And not only that, how to do it. That's the most important part, how to deal with it. I know many dentists who were trained on doing implants, and they are doing it successful maybe 2-3 years. I bet you, Nick, they are doing it very great to the point where they don't have complication. But once one case of complication arises in their clinic, this is the nightmare that they start having. So in our course, we're trying to focus on really how to deal with different cases and scenarios, because it's important to me when I let you go practice in your office 2 to 3 years later, you'll find these cases. You'll find loose crown. You will find fractured implant. You will find, and why? Why did this happen? Like, there are many reasons why this happened. It's just like, as you mentioned, because the records were not taken and were not considered, like, for example, for a clencher, and a clencher can break an implant. Yes, he can or she can break an implant so easy with just clenching. So I think after all these years, I'm very thankful for all those pioneers in implant dentistry and scientists, but it's the time for us now to take that step and to take this step actually and improve the way of teaching these courses. And I think it is an art, it is surgery, it is an effort, it is expensive, it is stressful, it is all. So I mean, I need to take all these parts and make it really in one unit that can be presented to the dentist, so that, as you mentioned, when they go to their office and they place this implant, and that patient come in the hygiene visit and say, oh, my crown is loose. Do you know why? I just gave you $3,000 or $4,000, and then so what are you gonna do? Like that's the thing that we're really missing. Unless you go to a specific course and you spend another 5-6 grand to know about complication. I mean, it's a different thing.
Yeah. So, I mean, one thing that I found interesting because you run 4 practices and they run very smoothly, like most, it is really a team effort. Like, it doesn't matter how great of a dentist you are. If your team don't know how to talk to patients, if they don't know how to present treatment, even like you mentioned with the assistants, it's like, well, the dentist might go to the course, but does their assistant know what to do? Have they seen the experience, right? It's different for them, right? Just because you've got a plaque on the wall saying, you took an implant course doesn't mean, next day there's 20 people lining up outside waiting to get implants. You still need to know how to market those courses, right? So what I wanted to learn is more from an operational standpoint, right? Because being you run 4 practices that I've worked with now for a few years, and they run very smoothly. Things run kind of like clockwork. What's sort of the secret there? Most dentists that I speak with, they're really struggling to run a single practice. It's just chaos every single day. Whereas, you're able to bounce around from 4 different offices, have associates. So What's the trick there? Is it just having a really good manager? Is it just like bringing the team into the training, make sure that everybody knows how to do every piece of the job? Like, talk to me a little bit about that.
Okay. It's very, very interesting question, Nick, because I think the staff can either bring you up, make you successful, or fail you. And when we talk about that, any dentist like really need to consider when they are trying to give more advanced work, their staff must be as like trained as, you know, as much as he was trained. Because the problem is, as you mentioned, when I'm inside the room, I'm doing this surgery. If my assistant was not trained the same way I was trained, she's excellent in raising the flap, retracting the tissue, preparing the room, taking care of your inventory. She knows every single thing about the process. That it doesn't mean that you know what you're doing. It's enough. No, your assistant needs to do what you're doing, because if she doesn't know what you're doing, then obviously all the stress will be on the head of the dentist. And believe me, after 5-10 years, you'll feel like really exhausted. You will be burned out for sure, 100%. So the key of success, in my opinion, is I gave my staff the same way of training that I got, the same level. And when I say the same level, I take them to like CRX doctors, like Patterson for sterilization, like surgery, like different courses, surgery in UFT and everywhere. I send them by themselves. For example, like the treatment coordinators I have with the dental management secret, my managers, they learned how to like really manage offices. They need these CE courses same way you need it. If I am the dentist graduating 20 years ago, how am I going to improve if I don't take all these CE courses? I do residencies, so I'm advancing my knowledge. But what about my staff? If I don't bring my manager to the same level of my skills or my dental assistant, they are out of the game. They are just not there. So for example, in the mini residency I attended, I had to ask the facility there to bring my staff to where we were doing the clinical, so that they need to see the dynamic, how they do the advertising. For example, placing brochures and books in the waiting area, putting this on the TV, speaking to the patient, arranging the. I can't do that by myself. Like I can do the surgery or the software or the treatment. I can't take the pictures for the patients. How are you going to take pictures? Most implant courses, like not most, all implant courses, nobody teach you how to take pictures, for example, for your patients.
Or like nice documentation or everything. Yeah, logistics. It's all just.
Yeah, I mean, documentation, they might teach you, but what about your staff? Like your staff are doing all these things. Like you have to go back and then, okay, I need to start teaching you how to do this. And now what? Guess what? One of your assistants is good. The rest they don't know what they are doing. And it's just going to be affecting like a negative thing on your progression. So I copy paste what I have every single place I go. I go to the north in Thunder Bay. I have my Mississauga office, Hamilton, all the technologies, all the milling machines, all digital workflow.
It's like identical process,
identical process. And they are all trained the same way. And we also have virtual meetings almost all the time. And not only that, rewarding is a key. So
I mean, your success really is dependent on your staff. I mean, your success.
I'm nothing without him. I'm telling you, I'm nothing without him.
One thing I liked from the course was that even if you're not a dentist, there is a lot you can learn to understand how things can go wrong, right? So even when I was there to attend the course to be there for marketing reasons, I was actually just curious to understand, to learn like why is Invisalign so complicated? Why are clear aligners so complicated? It seemed pretty simple. You take an impression, you just send it off, right? And you learn a lot. You learn about all the things that can go wrong. And I think what the staff would gain out of that, like the fact that this course, you also bring everybody. It's not just for the dentist. You bring everybody from your team.
Yes.
You start to see how you can explain it to patients, right? Because sometimes they'll call and they'll say, well, do you guys do implants or do you do Invisalign? And the person says yes. It's like, okay, well, why should I pick you?
Exactly.
Your practice does Invisalign, so does 30 of them across the street,
True.
around me. So what's special about you? And a lot of people don't know how to explain that. They don't, it's like, well, we just have a really good dentist. What makes them so great? Oh,
Or
I don't
financial,
know.
maybe sometimes they go down in financial, but you really
We do
don't
it
need to
cheaper.
do. Yeah, let's do it
Yeah.
cheaper. It's not this way. No, it's the value of your, and the value of your office is the staff. One of the main value of the office is the staff. And I always focus and concentrate on rewarding, which means, have you ever thought taking your staff, and for example, if we do 50 implant cases, we're going to Mexico this year. I know it's pandemic, but we're still planning because my staff achieve goals. I need
Right.
reviews from my patients. I want this number. It doesn't mean that they don't do it, but it is really lovely and beautiful. If someone rewarding you for your hard, you're making money already, right? But if you get rewarded for what you did and the whole team what they did, so I presented in, okay, guys, let's in our monthly meeting, let's have a goal like in the beginning of the year. For my managers, for example, I have set goals. They all know what they are going to do a year in advance. Okay, so they have goals. We discuss goals, and then we do follow up. Anything goes wrong, we kind of tweak it out a little bit so that we can go and correct it and do what we really need to do. But in my like I will say I had four of them for almost now 5 years, but I did have two of them for almost 9 years or 10 years.
You mean the
And
office managers?
yeah, I mean, not only the office manager, the dental offices. In these really times, in this time, sorry, I found that everybody would like to get clear instructions, clear goals, and support, follow up, rewards.
Yeah.
These are the main things that any person would like to. I cannot expect from someone who's not trained in implant dentistry to be ideal. I will say, what the like why you're not learning the course? Because you know what? Because you cannot expect that they are excellent as you. You are trained and you know what you're doing. You know your implant rolls, you know the kit, you know the bone graft material, but your assistant doesn't know that. Your front desk, maybe she's not aware of what kind of implant system you're using. If you ask her, she doesn't know. But that's why I'm saying it is important to work as a one unit. And the key of success really, and why things go smooth, is that everybody knows like exactly what's going on in the office, what the dentist is capable of doing. And not only that, the beauty of it, let's say you have one of the staff get pregnancy or maternity leave or whatever reason she leaves, and then you need to hire someone. The new hire will really learn the exactly same way of what they were learned, and it is easier for them. They will like it. They will like the dynamic of the office, and of course, I mean, with time they become better and better and better. And yeah, I think why these offices run smooth. I think because I believe in staff education, staff
Well, they're part of the team and they
support.
feel invested, right? Because I
Of
think
course,
with a lot of practices, what I see is the dentist invests in great technology, right? So they have the latest equipment. They spend tens of thousands of dollars on courses every year to get the best. But the staff, it's like, well, you're on a different level, right? It's kind of like you just do your job, you figure out your stuff. And it's like, but this doesn't make sense because this won't create an atmosphere of how can I feel invested in your business if you're not investing in at least training me to do a good job? Like, it's not that the staff, don't want to do a good job, is that they often feel like they're, might be neglected. And I think one thing I noticed now that you pointed it out in your practice is everyone feels like they're almost like owners in the business. They feel like, you've invested a lot of time and energy into them and they want to do well. But I've seen practices where the doctor invests a lot into the physical tools, their education. But as far as the staff, it's like, okay, here's your salary, come in, answer phones, do whatever. And then when things don't work out, they get really frustrated. It's like, but you've spent years learning and you've given them no training.
No,
What
nothing.
did you
Yeah.
what did you think was going to happen? You're setting them up to fail, right?
Yeah.
So yeah, I agree. I think that, if you're going to go to a course, like, I'm not a dentist, I'm not a doctor, but I still learned a lot, like seeing how you're doing the work, why you're choosing
Sure.
certain cases, why you're not choosing certain cases. And it makes a light bulb go off, right? And I think it would be very helpful when, you have that knowledge that when a patient comes in, they can qualify some patients for you if they see that they're a smoker, a boxer, right? So that was a funny story I had with one of your instructors. So Dr. Ali, and you mentioned you had a patient and you said, are you going to guarantee this implant for life? It's like, well, if your part-time hobby is kickboxing, no, right? But you don't know how to talk to patients about that, right? Because again, these courses don't prepare you for these conversations. Like, well, what happens if the patient asks you this? What happens if they're nervous? How do you calm them down, right? It's small things that I think people don't realize how big of an impact that they're going to have on your success. Because like you said, they're nervous. Now you become nervous. They see that you're nervous. They become more nervous as well. The whole thing is just spirals out of control. And it's like, I think the theory is great. I think from what you mentioned before, any course you go to is going to teach you the fundamental knowledge really well, but it's all of those little things that people take for granted. How do you set up the room? What information do you ask this patient before saying, accepting their case? Like, what are some indicators that this might not go well? They might not really be compliant. They might tell you right now they're going to do all these things, and then in 6 months, they're going to come back and they haven't quit smoking. They don't brush their teeth. They don't come in for cleanings. And, when you have enough experience, you can start to spot these people ahead of time. But when you're new and you've only done 3 cases, one on a typodont, one on a pig cadaver, and the other one on your cousin, you don't know how to identify these problems, right? And I think what I liked with the courses you put together is you spent a lot of time talking about all the things that can go wrong and how you start to deal with it and how you prepare for it, and ideally how to avoid it, right? Because that's the best sort of
the goal is to avoid it.
The goal is to avoid it, right? But not, it's not always avoidable.
Yeah.
But also things like, how do you take photos? How do you get your team to, market these things and show the cases and talk to patients about it? And how do you deal with when the patient's not being compliant? What are some good ways to approach it? What are some cases that look good on paper, but then you realize like, hey, look at these warning signs. This person might have TMJ, TMD, and you didn't check for that. So when they come back later and they say, well, now I'm getting headaches and my jaw hurts, and I think it's because of the clear aligners you did. It's like, well, no, hold on a second. We did this test 6 months ago before we did it, and we identified that you have this problem. We recommended that you treated it. But a new dentist, not knowing that, it's like these are the pitfalls you're going to fall into. Like these are the problems you're going to run into that you're going to have to learn through the hard way from experience, right? So yeah, it'd be ideal if more courses spent a lot more time talking about the business elements, the logistical elements, the communication elements that are all very necessary to succeed with any kind of cosmetic dentistry you try to introduce into a practice.
Yeah, that is true. And one of the also questions I get from colleagues, okay, I spend lots like tons of hours of training on some staff member, and then they leave. I say, well, why they leave? Like they leave for many reasons, right? Like, I mean, you can't count how many reasons the staff they can leave, and you cannot avoid it, of course, but you have to gauge as well how much this turnover. Like, is it like every year? Is it like every 5 years? You cannot avoid that, but I still say, yes, they leave, but better people, they can come and you can spend same time, same effort with them, because your success and their success is the same, right? You have a goal. Like you want to be successful, and you have to be having a successful team in your beside you, supporting you, as you mentioned. Now, other thing I wanted to add to these courses that that I took and I learned. I took some courses in India, in Caribbean as well, where I placed tons of implants and do like these sinus lifting procedures and jaw reconstructions and bone grafting. Now, it doesn't come in one day. I mean, some people are like, or dentists ask me, well, I want to do this immediate case, or I want to do this bone augmentation. These things doesn't come in a day and night or in one courses. We are especially in implant dentistry, it is like a curve of learning that you have to take this journey, and you are expecting that you have to add to your knowledge in every single year. I don't waste every single year in my life without taking some interesting courses here and there. Mm-hmm. And like with these Caribbean or whatever destination is, it is nice to go there. But for me to go there now, it's because I know what I'm doing. It's different when you don't know what you're doing, and then you go practice and you think you are doing well, but when you go back home, half of these cases were failed, and nobody tells you, because you gave them the money, and then you came back to Canada, and then you thought like, oh, I placed 40 implants, 30 implants in this course.
But would any of them succeed?
What did you do? Did you see them? Did you place the crown? Have you followed up with those cases for 5, 10? You can't do that. But when you have this learning curve, like you take it step by step, and that's why we call it step by step, because it's really step by step. There is levels, and you have to start with where you can start placing implants, negotiating presenting treatment plan, bringing more patients flow to your office, and then the second level where the very more complicated cases will come, where there is no enough bone thickness there, how you regenerate bone there, and then you go further and further and further. And in my opinion, again, these steps need to be clear. For example, I'm telling you, one of the courses I was to do, I said, let me do sinus lifting. I want to do that. I want to go to the second level. And then I went to the course. They gave me an egg, and with a piezo, I swear, you need to peel this piece of the egg without perforating the membrane, because it stimulates the same membrane of the. Like, come on in now. Like, you want me to learn in an egg, and then I go and drill a hole in the sinus on the maxilla? Like, come on. Like, this is not realistic. Believe me.
It's a good first step, but if you don't have the other steps to progress to a real patient,
I mean, typodonts is great, but I couldn't. Like, when I returned back home, and it was one day course, I couldn't say to myself, okay, I peeled this egg. Can I go now and I can't.
Yeah.
I cannot. So, or watching videos on YouTube. No, this is not what we should be taught, the way how we should taught. It has, like, everything has to be stimulated really exactly before we go to the second level.
I think the problem is, from a logistical standpoint, it's a lot easier to offer a course that focuses on theory, PowerPoints. When you're trying to get patients, it might be a logistical nightmare. You might be able to create a course like what you're doing, where on a small scale, you can take a group of 5, 10 dentists and teach them over the course of the year. But if you are doing this as a large business and you need to teach thousands and thousands of dentists, how are they going to find thousands and thousands of patients for them? So I think what separates your course is it's smaller scale, and it's more boutique, where it's like, this isn't a business where we train 10,000 dentists a year. Like, let's just pick 10 and take them through this program very carefully, very one-on-one. And it really strikes me as more of a passion project, right? Because knowing that, helping you like put together this course is, what's interesting is you could tell that it's not necessarily very profitable.
No,
And you're doing
no,
this more for,
no.
because I actually did speak with your staff and I said, like, well, what's the motivation? He runs 4 practices, like what now? And also now a course. And it's like, well, he's done so much time teaching all these associates that it's like, it's just much more efficient to teach them in a classroom environment. And if other people want to come, sure, they can come, but it's more of an efficiency for you. So yeah, no, I think that any dentist that's trying to learn this stuff, I was shocked to learn how most of these courses are done. Seeing how, you're going out of your way to find patients for them to practice on, mentoring them one-on-one, following up with their cases, making sure that they really are successful, not just trying to like, hey, let's sign up 100 dentists, right? Like, who cares if the education sucks or if it's not really, doesn't really prepare them. Just get people through the door. Just get people through the door, right? I can honestly say, yeah, like I think you're approaching it very differently. Less people, much higher quality education. If it makes money in the end, great. If not, it doesn't really matter. It's really just perpetuating that like good knowledge and experience to the dental community.
Yeah, so we forgot also to talk about like this facility in Dental Toronto. Like when I went, like this academy is just like brand new academy. We're very lucky here in Canada to have the academy because in the States, I think they have only two, one in California and the other one in Scottsdale. And the beauty of the academy is the simulation labs they have. That
Where
will
they have like
really
real,
give
almost like real patients and
real
yeah.
patients. You got the real patient. You got the experience of having your screen in front of you, see the CT scan, or watching the dentist doing the procedure with a microscope. All these details are really very interesting. And not only that, the like first course, like some dentists told me, they sign up for the course, and then when the clinical part comes in, okay, go find your patient. Like I'm an associate working in an office. How am I gonna bring a patient if for example, the course in Toronto and I work in Guelph, for example, who's the patient who's gonna drive all the way to Toronto to get his or her implant, and
And it's
for
shocking
what?
because for the price that a lot of these courses charge, because I was shocked. I mean, you were
Yeah,
talking, $20,000 courses. You would think, there are people out there who would want free implants, right? Like low
yeah,
socioeconomic, like you can find, right? If you, because you see these dentists where they advertise $499 for implants, right? And obviously it's a joke because
yeah,
it doesn't include anything, and I'm guessing you probably fix a lot of $499 implants every year, right? So
yeah,
you think for the price that these dentists are paying for this course, like these companies can just find them some patients, find a couple patients that are willing to come in that are from Toronto that would want either heavily discounted or free implants. And it's like, hey, the
yep,
understanding is, it's going to be a young dentist, but he is going to be supervised by somebody that has been doing this for 20 years. They've done thousands of implant cases. So
yes,
you're in good hands, right? But
yeah,
understand the reason these implants aren't costing you $10,000 and it's free is it is a training facility, but it's state of the art, right? You would think that, these courses would do that, but none of them do. And I was really shocked that this is the first course in Canada
uh-huh,
where you are taking the responsibility to find these people patients, right? It's like you're not going to, if you have your own, you can bring your own. But most of, like you said, if they're young, they're associates, like who are they going to bring?
yeah,
Their mother-in-law, right?
yeah,
Like that's like,
yeah,
who else is going to really trust you there,
yeah.
right? So I think that's it's a huge benefit that not only like you're learning so much on the course beyond just the theory, but you're also giving them the cases,
Yeah,
right?
and also you don't have to pay for the implants you're placing. That's another interesting thing I have seen in the courses. You have to pay for the implants you are placing in that patient. So
Yeah, so you pay like $18,000,
and
but
then on
plus
top,
this,
yeah,
but plus
plus
this,
plus
but
plus,
plus this,
you
and
end up
yeah,
paying another 4 or 5 thousand, and it's too much for someone who's coming for the first time. He didn't even place implants before, right?
yeah.
So they are expecting to gain some knowledge, place implants down the road. So as a startup, we like when actually the doctors in the board of High Tech Dental Seminar, we were discussing how much we should put that course for. So I told them, to be honest, and I don't care about the loss. Um, I do care about the educational experience in this course. As you mentioned, if we could break even, we could not, maybe not. I mean, but the good thing, we got a good, very good partner who is Dent Supply Serona, and those people are really thrive to like to give what they can to the dentist in order to be really qualified to place implants. And their passion, our passion together, we put a very, in terms of pricing, because everyone will look for pricing as well. So I think it's very convenient.
My concern with it, to be honest, was that I thought it was significantly cheaper than every other course. Plus, you teach not just the dentist and all of their staff. Plus, there's no fees for implant; like it's all included. It's one price. There's no extra anything. And you get them the cases. My fear was everyone's going to be suspicious. Like, why is it thousands of dollars cheaper than everyone else? Right. And I was trying to get the message across. It's like, because this venture that you started was never intended to be like, we're just trying to make a bunch of money. It was purely motivated on like the education that's out there for dentists when it comes to cosmetic dentistry really is kind of lagging. It doesn't really prepare you for the real world. And this was just more of an experimentation to see, like, can we do a better job teaching these people? Definitely commend you for that. I think, it wasn't a sales pitch. Like I worked with your team, and I think that they all legitimately just really wanted to do a good job and create the type of training they wish they had when they were starting out.
That is true. Thank you for this. This is really important question, to be honest. Actually, I have worked, I would say, for almost now 3 years with to do this. I have selected the people that I would love to work with. That's number one. Who are really passionate to give. Number one, they have the experience and the knowledge, and they have the passion to teach. That's number one. Number two, I went to the logistic, as you mentioned. So the way how it worked, actually, it was because I have these 4 companies that they are already established and running. I didn't have to put on that, like when you're gonna bring all these like staff members and people to teach in that course. All these people are already funded by my company, so I didn't have to pay them. That's one of the things, which is huge.
I see. Yeah.
Number two, the clinical, the surgical, the prosthetic, it will be offered in my offices in Hamilton and Mississauga. The CT scan, for example, even the CT scan for the patients, which cost like between $250 to $500 each patient, for all these dentists will be taken for free in the course, and I'll be the one responsible for taking the CT scan, because no one can take it unless he's certified or she's certified or licensed. So I'm taking it for free. I already started collecting all these CT scans for those attendees so that they can have them ready to do their surgical guides. So, and then I did this partnership with Dental Serona, and Dental Serona were really very generous. Big company, have big facility, and all what we are doing is really, we are doing it without charging like the place or the venue where we're doing this. Of course, there are some expenses for the lecturer, for the some parts of the implants that we are purchasing. But yes, to be talking about the financial, it is all supported by my companies and the Dental Serona. Otherwise, I wouldn't be able to really make this adventure really easy, less expensive. I'm not going to say cheap, because the knowledge they can get from there, they are going to get all these patients provided to them with their CT scans, guided surgery, conventional surgeries, all the staff supporting, teaching your staff. It's all supported with what I have and it's my passion.
Yeah, it's from a marketing standpoint. Our challenge initially was people thought there must be a catch because yeah, I've seen pictures of how a lot of these courses are done in a hotel or in a basement somewhere, and meanwhile this course is happening in like one of the most state-of-the-art facilities I've seen. There's only two in the world, and they actually simulate like a real patient, real head, real jaws, that kind of stuff. So instead of just a typodont on a table at the Hilton, right? And on top of that, it's like it's not just for the dentist. The whole team comes down and learns, and there are sections where the staff get taught one-on-one by your staff members of like, here's how we do hundreds of cases a year. Here's how we talk to patients, right? So you have that element of it, and there's and then again, the price of the course is thousands and thousands of dollars less than those weekend courses that are taught in a basement. So my challenge initially was, people are going to think there must be a catch. Like, what's the catch? How do you get me patients? There's no extra fees. It's significantly cheaper. It's in a much better place. And like you mentioned, it's like part of it is, you're already paying your staff. So this isn't an extra expense. It's a good learning opportunity for them too. And on top of that, Dentsply Sirona, working with you and other larger companies like Patterson, they're able to kind of like help you so that you can keep the costs incredibly low for dentists. And, I swear to everybody, it's like, this isn't a huge money-making venture right now. It's a passion project, and who knows how long it'll last. It might eventually have to turn into a real business with real staff.
My plan is still retirement. That's my plan.
Okay.
And I don't look so old. So it should be like for another 15, 20 years.
Okay, awesome. But yeah, if anyone's interested, I guess they can check out hightechdentalseminars.com. And normally what we would do is we put you in touch with Dr. Ameen, and you can ask your questions, because people have technical medical questions, surgical questions. What are you going to learn? So yeah, I definitely advise any dentist, like if you're wanting to learn to do implants or Invisalign or anything like that, instead of spending thousands of dollars for a video course, which I've seen a lot of them do, I think this is a much better one to consider. It's still a startup. It's the second year, correct?
Second year. Yeah. And one more important thing I forgot to mention is that we put the courses like the Invisalign, the clear aligner course in September 25th. And the November course is for implant, because we believe everyone will, especially health provider, dentists, will get two doses of the vaccine. So everything should be good by that time. And also we put in consideration that new variant, hopefully not, I'm hoping not, but new variants can arise here or there. So we have like a plan for that put into place. We have policy, cancellation policy or rescheduling policy.
So if anything happens, you're not gonna, we'll just push the course or refund the money back.
But as of now, everything we're planning is going on track, and I believe like 95% there won't be an issue, because even we have policy like a COVID policy in the dental office, a COVID policy, and you guys who want their dental Sirona have their own, the academy has
they were very
policy.
Strict, yes.
Very strict, yeah. So, I mean, we do have our policy there, and it's ready and in a place, but you never know, like what we are expecting. This world is going crazy now. Yeah. So if anything happens, there is a cancellation or rescheduling policy. Like, for example, myself, I was supposed to go to Scottsdale in 2020 in August, and because of COVID, I didn't go there, and now I'm leaving again this August after 2 years, and I did reschedule my course, and I'm leaving in August to go there in Scottsdale. And the happy thing is that whatever I saw in Scottsdale and learned in CRX doctors or digital guided surgery, I was able to bring it to this course, which really pumped me out because I'm super happy.
Yeah, there's a difference in quality of courses between Canada and the US. I think even in the US, I mean, they don't tackle that serious issue of you need real cases. It's not just theory. You need to practice on real patients, and you need in the first few of them, you need to do it with somebody watching who knows what they're doing, right? Because you won't know that you're making mistakes. And like you mentioned, you can fly to Mexico, you can go to Dominican, you can place 50 implants in 10 days or whatever, but you're never there to see, did they recover correctly? Were those implants successful? Like, what was the end result? I guess you drilled, you placed the implant, great, and then you flew away. But that's not a success, because in the real world, if something had gone wrong, you're still the one that the patient's going to come back to. The one in Dominican isn't going to come back to you, right? Because you just paid to do your implants. You got your certificate. Here you go. You place them. But in a real scenario, if you see with dentists, they'll advertise $4.99 implants in the bottom of an office somewhere, and then all these problems start to happen, and then they disappear, and then you see them open up in a different city. $4.99 implants. And I've listened to cases like because we record thousands of calls every month, and I've personally listened to cases where somebody's crying over the phone saying, I went to this dentist, they're low income, they couldn't afford it, they went to the cheapest dentist they could find, and now their dentures broke, and they're trying to call this old dentist. They're not responding. They went there, they're not there anymore. What am I supposed to do, right? So I think, like what from what I understand, your staff have mentioned, you were really motivated to make sure that if you're going to offer this, do it right, because it's just going to cheapen the whole dental industry if you have all these courses that don't really prepare dentists to do a good job, and then people stop trusting dentists. It's like, I went to that one guy, didn't know what he was doing, and now they think that every dentist is a crook. And it's like,
unfortunately, Nick, we don't have like fixed prices for everyone. We do have like a fee guide from the Ontario Dental Association, but I would hope in the future that these prices will be fixed for all people, so that nobody can, offer cheap dentistry, because I don't believe in cheap dentistry, and never done much, never, thought about it even, because I think we should go with what the fee guide goes by, not more, not less. That's what I believe. I wanted to mention one more important thing for dentists in Manitoba or BC or Montreal. They are still able to attend the course and the mini residency of high-tech dental seminars by going to the
RCDSO.
Yes, there is temporary licensing so that you can practice to place implant in Ontario, and they can do a temporary licensing thing.
Okay, awesome. And so I believe that's on the website. So if any dentists are outside of Ontario, because I guess they wouldn't be legally allowed to do that, you can get the temporary licensing. So that Okay. Fantastic. Well, thank you so much for your time. I think this was a great interview. I think
thank you so much, Nick.
We'll get a lot of great stuff out of it.
Of course. Thank you so much, Nick.